All right, welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. It's Paul Thomas. It's Bill Kearney. It's North Lake Medical Pharmacy, and it's Health Talk. And Bill, how are we doing today?
Oh, it's great. This weather has just been beautiful. Fantastic. We had a Super Bowl party on Sunday, and I actually went. I took the boat out and went over to Paradise Cove and picked some people up. And it was like 70-some degrees. Wow. And then after the game was over, I took them back. And there were people over there barbecuing off their decks and everything in the little channels, and it felt like summer.
Sure.
But I hope it isn't. I hope we get a lot more rain. But this is really a good feeling, but I really want the rain to come back. And heck of a Super Bowl game that we had.
I was going to say, how did you like the game?
I even liked the outcome, but
I
mainly because of the quarterback and his actions. But it was a well played game and fun to watch and fun to have people participating. And
so, did you overindulge in the food and the libations?
Not in the libations. I was and not really very much in the food. When you have something that big, and you have 40 people over your. You have a lot to do, and I have a driveway that is kind of downhill, and with my bad leg, it was. I was in pretty bad shape after the day was over, but
why were you parking cars?
No, just going downstairs and getting more libations, and fixing people up and waiting on people, and I have a stairway, so some people were downstairs, and but I got through it, and I'm back in physical therapy, and I'm swimming now. Swam Friday for 70 links, and then 70 again on Monday.
Wow.
So I'm still in a lot of pain. I haven't been taking any medication for the pain, and so I'm gutting my way through it because I've got to fly to Nashville to a board meeting the first of the month, and I've got to be doing okay by then. But I'll have my wife with me, so she'll watch if I fall over and try to pick me up. But lots going on, and if you're not interested in politics, or the Zika virus, or
what's that thing all about? That's
we're going to talk
scary,
a little bit about that today because it seems to be growing at a rapidly fast pace. Although it's in the communities or the states that have a lot warmer climate than we do, but it will eventually. I mean, we have cases already in California. Because people travel, this is Carnival in Rio right now, and I know people that were over there. If we're not getting pregnant, and you and I wouldn't be getting pregnant, of course.
I hope not.
We may look like we are at times, but it's a really a great risk for a female that is pregnant or maybe getting pregnant with this mosquito bite called the Zika virus. So I thought we would just go over a little bit about why you should be worried about it. It's part of the same family as yellow fever or West Nile virus. It seems like we always come up with something like this, dengue. But there's no vaccine to prevent this, and there isn't going to be for quite a while. So even though the symptoms are pretty mild, it's commanding attention because of the connection between the virus and microcephaly, which is the situation where babies are born with a small head and a brain not being very well formed. So it's a neurological order that results in them with those kind of conditions, and it causes severe development issues, and in some cases results in death. And if you've watched Paul on the news, and they show these babies over there by hundreds that are getting that.
Not to be insensitive, but didn't they have a while ago, or at least I thought I saw, isn't it also kind of known as pinhead syndrome?
I don't know that, but I think you're right.
It is, yeah. Because I've seen pictures of people that that have that same shape of a head.
Well, I've heard Bill O'Reilly ask about pinheads,
Did
but no, that's a joke.
Okay, all right.
That's a political thing.
All right.
Sorry,
I don't watch Bill O'Reilly.
You thought you were in. Well, I don't
I
either.
didn't catch it. But.
I don't either. I had it on for some reason. It was on the radio when I drove home, and it's whether you're something or a pinhead. I didn't know.
Gotcha.
Anyway, you thought you were insensitive. But then, what are the chances that we would get? Excuse me, the Zika virus. It's a mosquito that bites a person with an active infection and then spreads it by biting others, the insect, not the person. This was originally discovered in Uganda, and it's now predominantly raising concerns in Central and South America. If there are no infected mosquitoes in your area, you're likely to not contact this disease. But on February 2nd, just this past week, the CDC confirmed the first case of sexually transmitted Zika in the latest outbreak. A male partner who had recently returned from Venezuela, infected with Zika, returned to the United States and infected their sexual partner who had not traveled. So in this day and age of us traveling from continent to continent and country to country, the chances that we would be immune from any of this is highly unlikely. So the CDC had issued interim guidelines for prevention of the sexual transmission. At first, they didn't think that was available, that would be an issue. And there have been no reports of sexual transmission of the virus from infected women to their sex partners. This was from the male to the female. Until they know more, if your male sex partner has traveled to or lives in an area that's active with Zika, you should abstain from sex or use condoms. But it's 1 in 5 will develop the symptoms, and symptoms are typically mild and temporary, and there isn't any vaccine. So while the virus has been documented in breast milk and saliva and urine, it has not been confirmed that the virus can be transmitted through any bodily fluids other than blood. But I am very leery that it can be. There have been isolated cases of spread through blood transfusions or sexual contact, and that really isn't very surprising, but the virus is in the blood for about a week. And how long it would remain in the semen is something that needs to be verified, and they're working on that now. So say you get bit, and only about 1 in 5 people with the virus will actually become ill. The most common symptoms are fever or rash or joint pain or conjunctivitis, red eyes, and that can be a number of any kind of disease, and that includes muscle pain and headache. For most people, the illness is mild with symptoms and lasts from several days to a week. They don't get sick enough to require a hospital visit, so the chance that you would see them in the ER is pretty small. But more seriously, it's been linked to the birth defect and microcephaly, as well as Guillain-Barré syndrome, which is where the immune system attacks the nerves. And that's another one of the situations where some people that get the flu vaccine actually develop Guillain-Barré. So additionally, once a person has been infected, then she or he is likely to be protected from future infections. But what does that do for you? So if you think you've been exposed, you need to ask yourself some questions. Are you pregnant? And you and I can answer that fairly quickly. And this next one we can answer fairly quickly. Are you a woman who's thinking about getting pregnant? Well, I hope that's me. I don't know about you. Are you a man who's going to have unprotected sex with a woman who is pregnant or may become pregnant? And if your answer to any of those 3 questions is no, there's arguably no reason for you to get tested. Only 20% of the people who contact the virus will even develop any symptoms, and those who do will experience only mild symptoms. So there's no way 100% that you're going to know that you have it without being tested. So if you answered yes to any of those questions, you should contact your doctor about being tested for Zika. He or she can order the blood tests and find out. A blood test performed in a clinical setting is the only way to really be finally diagnosed. So the difficulty is excuse me, how can I be treated if I have it? Unfortunately, as of now, there isn't a vaccine or any specific medicine to treat the virus. They recommend getting plenty of rest, drink plenty of fluids, take medicine such as Tylenol to reduce the fever and pain. Do not take aspirin or other non-steroidal anti-inflammatory drugs. If you're taking medicine for another medical condition, talk to your healthcare provider about taking it. So a lot of people have asked, well, why don't we just get rid of the mosquitoes? What good do mosquitoes do? And very few people can see any benefit from having mosquitoes, except in the ecological environment of Florida and those kind of places where they are a source of food supply for birds and some of the bugs and other insects. But if you were to kill all the mosquitoes, would it be any better? Well, the chances are we've tried to do that in several instances back in the 70s and 80s, and they used DDT. Of course, we can't use DDT. The best hope is to limit the number of mosquitoes in an area to reduce the risk, and they're taking about actually speaking and talking of having a genetically modified mosquito that would get the bacteria and then would die. The major concern with the mosquito-borne disease in the areas where they are is on the rise, and it's probably going to be an issue that we'll need to develop a vaccine for. The future of mosquito control is not a way that we're really going to be able to eliminate it. We may be able to reduce it. It's important to remember that the mosquitoes can play a very important role in the ecosystem, and that's hard for me to believe. But just because they don't appear to be going anywhere anytime soon does not mean that we must keep ourselves from testing them and making sure that they do or do not have the virus. There's a number of ways to keep them at bay, and we've gone over this with bugs. DEET, the most basic level, you don't have pools of standing water. And that's an issue right now. Here we are. We were, 2 weeks ago it was raining, or 3 weeks ago it was raining. We've got all these little puddles around, and then it gets to be 70 to 80 degrees. And here's perfect breeding conditions for mosquitoes. So if you're outside and you see that, make sure that you dump those containers that have water. There's not much you can do about a puddle unless it's small enough that you could get the water out of it. If you're outside and insects are making a nuisance, you know enough to put on bug spray and a long sleeve shirt. It's also a good idea to keep an eye on reports of increases in the level of mosquitoes, and I think that will be fairly dominant in the future with this threat. If levels of those mosquitoes can temporarily be brought down, people should take personal precautions such as wearing repellent and wearing the right kind of clothing. So this is just the beginning. It's not the end. There's going to be all kinds of information about what to do and what we're going to do in order to curb this. This effect of having these children with small heads and a minimum development in the brain is very, very disturbing, and one that we need to pay a good lot of attention to. Paul, did you ever reach in the medicine cabinet and get something and either put it in your eye, your ear, or your mouth, and it not be what you thought it was going to be?
No. No.
I mean, if you get up at night and you reach and you think you're going to put eye drops in and you put eardrops in your eyes.
No, I don't have that much. I don't have that much medicine around to make that mistake.
A lot of people do.
I'm sure people, yeah.
And
I can see it happening.
There's, and I really wasn't going to print this out, and then I thought, since I've been hurt, I've several times reached up to get eye drops and picked up something else. And most people's medicine cabinets are full of expired drugs and things that they shouldn't be using. So I took some of the most common things that could happen. So if you reach for a bottle when you're half asleep, or say you're on pain medication or something and you're not paying attention, You reach to pick up this bottle, which is normally there, and you put it in your mouth or drop it in your eye or rub it on your face, no matter what it was used for. But is it serious? Should you call 911? What should you do? And it really kind of depends on what it is. Some of these items, it's hard for me to imagine, but one of them was using nail polish solvent instead of eye makeup remover. And I don't usually wear eye makeup, so it's not something that I would do, but removing eye makeup after a late night out can really turn dangerous if you reach for nail polish remover instead of the eye makeup solution. There's a lot of organic solvents in the nail polish remover, which can be quite irritating and dangerous for the eye. The other night, one of the people I live with had put an external cream on her eye, above her eyelid, and it got into her eye. And she washed it out and washed it out and washed it out until the irritation disappeared. But the first course of action in doing that, whether it's an eye drop or whether it's an external preparation or something that gets in your eye, use lots of water followed by teardrops. You're also going to visit your doctor as soon as you can to determine the extent of the damage and call your poison control center. I'm going to give you this number because it's going to be mentioned about calling your poison control center through each one of these things. And it's an 800 number. It's 1-800-222-1222. Now, I wasn't sure about my memory, so I had Paul look it up to make sure I was right, and that's correct. 1-800-222-1222. And I would put that number on your refrigerator someplace where you know where it is, because it isn't only you that may need that. It may be somebody else. It may be your grandkids or your great-grandkids, and they think your medicine is candy, and they eat that, and immediately you need to get hold of the Poison Control Center. So there's common household product mix-ups that really occur, and you need to be aware of them. If you reach into your medicine cabinet again for eye drops and you pull out a bottle that looks like eye drops, guess what it could be? Super glue.
Oh, no.
And you'd be amazed at the people that take super glue when they're not paying attention, usually been drinking or they're subdued somehow. And one Florida woman was recently in a newsletter that something got into her eye, and she asked a friend to grab eye drops from her purse, and the friend accidentally handed her super glue, which she used to glue her nails back on. Luckily, a doctor was eventually able to pry her eye open, but once that adhesive, and if you've ever used super glue and you're just using it, it sticks on your finger and you can't get it off. If it gets on eyelids, it can cause them to close shut. So it gets inside the eyelids and hardening occurs. The crazy glue will just feel like a rock in your eye. So go to the emergency room or an ophthalmologist's office immediately so a doctor can assist in opening your eyelids and determine if any eye damage occurred. This hurts me even just to talk about it. And it wouldn't do you any good to call the Poison Control Center because it's important to get to an emergency room as soon as possible or your ophthalmologist. Now, this one might relate to you, Paul. You brush your teeth, right?
Sure, yeah, who doesn't?
And then some people use hemorrhoidal creams for hemorrhoids. I'm not saying that you do, but don't panic because the worst part will be accidentally brushing your teeth with a hemorrhoidal cream.
Oh, no.
I guess this happens a lot. Essentially, the hemorrhoidal cream is a steroid and will just be an irritant. So if the lipid base, which is the fat base, gives it a greasy quality, there will be no systemic effects other than the minor local irritation to the gums.
Wow. So,
and then another one that happens is an antifungal cream like Lotrimin or something like that has a tube just like that, and you end up and a lot of these things now are coming in these upside down bottles, so it looks like a toothpaste bottle that you invert and you brush your teeth with it and your hemorrhoids in your mouth disappear. and your antifungal yeast infection disappears, but it doesn't clean your teeth. Now, you'd be amazed at the amount of people this next thing happens to.
Okay.
In general, it's not too dangerous if you accidentally ingest your pet's medication. Common antibiotics are prescribed to pets that are essentially the same as those given to humans, although there may be different but harmless additives to learn more, to make it more appealing to pets. One exception is a dangerous class of neurotoxin medications that they use to combat fleas and ticks, and that can lead to a slow heart rate and seizures. So call your local control poison center. What's the number, Paul?
1-800-222-1222.
See, he's got her down. I actually had this happen one time for a friend of mine. It was on a holiday weekend. And one of their children had an ear infection, and they needed to get an antibiotic, and it was a holiday weekend and no physicians available. It was before the emergency room was open for emergency medication. So it was tetracycline, which is an old antibiotic, and it costs about 800% more than it used to, but it used to be one of the most inexpensive antibiotics, and it worked pretty well. And I said, go ahead. Use it. Wow. It's the same as ours, but don't ever pretend that you can get by with using pet's medication without calling.
Grew fur and
pardon me.
After using it, the child grew fur.
Yeah,
preferred to eat out of a bowl.
Yeah. Right. Yeah. Another one that I'd never thought of that I guess happens quite often is using pepper spray as a breath freshener.
What?
Have you ever been pepper sprayed?
No, thank you.
It is not a pleasant thing.
I don't doubt it is.
If you inadvertently spray your mouth thinking it's a breath freshener, that would lead to local burning and irritation of the gums, the lips, and the tongue. May even lead to an allergic reaction if you have a predisposition to contents of the spray, such as cayenne pepper. Signs of an allergic reaction, of course, is the lip or tongue swelling and swallowing. If you develop those symptoms, check and yourself into the emergency room. Hydrogen peroxide. You know what hydrogen peroxide is?
I used to dye my hair with hydrogen peroxide when I was in high school.
Yeah, but that was the strong stuff.
The 90.
Yeah. This is like 3%.
Mm-hmm.
And why did you dye your hair?
It was a thing back in the 80s. Kids did that, yeah. You had darker hair and you wanted to lighten it or make it blonde in areas. I did it like the top of my head, and yeah. You would put you'd dip your head in a bowl of peroxide.
Did it burn?
No, it didn't burn. No. It didn't. I mean, it didn't turn it like bleached or anything. It just kind of lightened your hair a little bit.
Well, don't drink it.
No.
It can cause irritation of the gastrointestinal tract with nausea, vomiting, foaming at the mouth. They're liable to shoot you for having rabies. But this, evidently, the medical center down in Orange Coast Memorial Medical Center at Fountain Valley, California, reports that this is an occurrence within minutes of ingestion, confusion, coma, convulsions. Cardiorespiratory arrest may ensure if the concentration is high enough. Most problems occur at concentrations over 10%, but even diluted solutions can be toxic. I don't know why anybody would reach in the medicine cabinet thinking they had water and would drink hydrogen peroxide.
The bottles do not look the same.
But it could happen. We're going to take a break, and we're going to talk about something new about a Healthy Kids free vitamin program in Northlake Medical Pharmacy. Happy New Year, everyone. This is Bill Kearney of Northlake Medical Pharmacies. As we enter a new year, we at Northlake Medical Pharmacies can reflect on the last 36 years and see the significant changes that have affected the healthcare industry, especially the Affordable Health Care Act, and more importantly, you. Even with all the changes, our mission has always been the same, to provide you with the best customer service possible. We want to answer all your questions before you leave our pharmacies. If we don't do this, then our pharmacists are available on the phone to answer those questions. We at Northlake Medical Pharmacies know you have a choice. When you have your prescriptions filled, we feel a great sense of appreciation to you, our customers, for making us your choice when filling your prescriptions. We look forward to serving you in 2016 at both of our pharmacies. at Hill Road next to Sutter Lakeside Hospital, and outside Bruno's Shop Smart on Lakeport Boulevard. Just remember, free delivery to Lakeport, Nice, Upper Lake, and Lucerne, and now to Kelseyville, the Rivieras, and Buckingham.
I believe that home is where your pet is, and that loving an animal means never giving up on them, never letting them go.
I believe that when you adopt an animal from a shelter, you are saving not only one, but many lives.
And that when you spay or neuter your dogs and cats, you help decrease the number of homeless animals.
I believe it's time we do all we can to save the lives of homeless dogs and cats who are counting on us, because every dog and cat deserves a place to call home.
I believe that I found my best friend in a shelter, and that you can too. I'm Lisa Edelstein. I believe.
I'm Emmy Lou Harris. I believe.
I'm James Avery. I believe.
I'm Travis Clark. We believe that together with Best Friends Animal Society,
We can bring about a time when there are no more homeless pets.
please visit our website at ambassadors.bestfriends.org to find out more.
Paralyzed Veterans of America, National Service Officers.
We've got an entire generation of men and women who have seen war. They're going to need voices.
Paralyzed Veterans of America represents them.
We're going to make sure that the Veterans Affairs gives them everything that they're entitled to.
Get all the health care they need.
Making a person's house adaptable.
And we also focus on getting them a job.
We help our veterans for free.
Changing lives, building futures. That's Paralyzed Veterans of America. To learn more, visit pva.org. A public service message from Paralyzed Veterans of America.
Imagine crossing a street busy with traffic. Against the light.
Watch where you're going!
Wearing a blindfold. Would you do this? Probably not. It's one risk obviously not worth taking. Some risks aren't as obvious, yet could be just as deadly, like the risk for type 2 diabetes. If you're overweight or over 45, if you're not very active, or don't eat as healthy as you should, there's an easy test you can take to find out your risk. It's free, and in less than a minute, you'll know if you're at risk for this deadly disease. Just go to diabetes.org/take-the-test or call 1-800-DIABETES. Because type 2 diabetes is one risk you can't afford to take. Take the diabetes risk test and stop diabetes before it stops you. A message from the American Diabetes Association.
All right, we're back. We're talking Super Bowl food.
Yeah, we're going over Super Bowl menus, and we're starved to death. Paul was talking about his 7-layer dip, and that was calorie-free.
I know,
yeah.
right?
We actually had Bloody Mary beans.
What?
It was like chili beans with tomatoes and tomato sauce in it and something else. I don't know if there was any alcohol in it, but they were really delicious.
I bet. Yeah, I love the taste of a Bloody Mary.
Yeah. And,
even without the alcohol.
Yeah,
right
and
there.
we had jalapeno peppers stuffed with
nice.
with tuna. I mean, with trout, smoked trout.
With smoked trout?
Yeah.
Wow.
But I can't top your last one. Tell our audience about the last thing.
What's the pizza?
Yeah.
I loved it. Bill made the face like he couldn't stand it, but it was a gorgonzola cheese, fig, and walnut pizza. So the fig was kind of like the spread, the sauce. It was like kind of a jelly, and then crumbled gorgonzola cheese on top and walnuts on a soft pizza dough.
Wow.
Yeah.
Ugh.
Delicious.
Yeah, no,
I loved it. I ate probably half of it myself.
Did you really?
No, and most people at the party, they did not like it.
Yeah.
My wife went nowhere near it, and a couple other people too. But, if you like blue cheese, gorgonzola is kind of similar to a blue cheese, and I think we must have a critic calling in because we've got the phones ringing right now. Let's see. Oh, if you were on there calling, call us back. Sorry. I did see you there. So
263-5252 if you don't know our number, 263-5252. We mentioned just before we took the break that we're coming up with a new program at North Lake Medical Pharmacies, and it's called the Healthy Kids Free Vitamin Program. And this program offers each child in your family, ages 2 to 12, a free 30-day supply of Good Neighbor Pharmacy children's chewable vitamins. It's a complete multivitamins. Every month, you fill out a form, come in and fill out a form, and at one of our pharmacies, and you'll receive a punch card and the first month's supply of the chewable vitamins, absolutely free. You can pick up a free bottle of vitamins every 30 days per child for a year. So this form asks for today's date, the parent's name, the address, the city, the school, telephone, your email if you have it. And then there's 4 columns for children's names that are at your residence. And we can even add more if you have more. But again, this is a Healthy Kids Free Vitamin Program at Northlake Medical Pharmacies. It offers every child in your family from age 2 to 12 a free 30-day supply of Good Neighbor Pharmacy Children's Chewable Vitamins, which is a multiple vitamin for every month. So you'll get a punch card when you fill out this form, and every month you come in, and each child has their own punch card, and we'll punch it when you come in or mark it so we know that you did pick up your vitamins. This isn't free to us. I mean, we actually buy the vitamins and give them to you, and we're trying to get healthy kids. So just like we're trying to do a wellness, if you noticed in the Record B today, there was quite a page of information about keeping well, and I'm a pharmacist, and I don't believe that you don't need any medication if your system is failing somehow. But too often we have treated disease states instead of making you change your lifestyle. And frankly, the government and the insurance companies are tired of this. And so there's a program in Lake County, and they're trying to educate people on how to stay well. Now, when I was on the board of directors at Sutter Lakeside for 10 years, the CEO that took over right after I came on the board was Kelly Mather. And she was a young CEO and really believed in wellness. And we tried to get the wellness program going at Sutter, but it was a hard sell 10 or 15 years ago. And people physicians are used to going to school to treat diseases, and not especially favorable to, not that they aren't, but that's not how they're taught to take care of their patients. They're taught the medication to give them. We go to pharmacy school, and we're taught to dispense that medication and tell people how to use it at their best advantage. We also tell them, and if you've listened to my program, very often it's diet and exercise, diet and exercise, diet and exercise, diet and exercise. And Paul's going over here
blah, 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 blah,
flipping
blah,
his
blah,
jaws, because he doesn't want to hear that. But I would guess the majority of people that take anti-cholesterol medication to lower your cholesterol probably could change their lifestyle and not have to take the medication. A lot of the people that are diabetics, if they had diet and exercise, would not have to take their medication unless they're a type 1 diabetic and they have their pancreas isn't making any insulin. A lot of the people that are obese would not have to take medication if they lost the weight. Some people can't do that, and the world is realizing that a lot of people need help with that situation. But lifestyle change is the way for many of us to survive and live longer. I just had... Are you on Facebook, Paul? You're not.
We use it here at work, but and I've got an account that I share with my wife, but I don't ever go on it.
I just had. That's how I keep up with my kids and my grandkids, and I just had a guy that was a roommate of mine in Chicago after we got out of pharmacy school. That had moved to California when I came with Walgreens, and we took the State Board of Pharmacy exam together at Golden Gate Park, and he went on down to Southern California, and he got into holistic health and coffee enemas and those kind of things for people who had toxic amounts of metals in their system. And I just got a blurb that he would like to be my friend. So I didn't know where he was. But he is in Ashland, Oregon, and has become one of the top-notch experts in the United States at impurities and toxic substances and pesticides and those kind of things. And his theme is to help you stay young. He will bench press 350 pounds. He's a little guy, but he is quite into health. And that's the program that a lot of insurance companies are going to try to sell you. And what we're doing with kids is, if we all eat properly, we don't need to take supplemental vitamins. But the amount of kids that eat fast food and don't get the proper vitamins is alarming. And it isn't because they don't have the money. It isn't because they're, in some cases it is. It isn't because they financially can't afford it, but it's because it's convenient for the parents or the people taking care of your kids to get them fast food. And that's what they want. They crave it, and they eat it. And I have, you've heard me talk about my autistic grandson, and one of the worst things that you can get by eating fast foods is that prolongs it are the breaded things, the wheat things, the things that are full of glutens, but that's what he likes. He likes sweets, and otherwise he doesn't eat anything. So I don't know what you do in a situation like that when you're a parent, and this has been going on for years. There's ways to change that, but you have to be careful and know that the toxic substances are probably killing a lot of us. Whether at 73 years old I want to change my lifestyle and drink water that's fortified with vitamins and minerals, I don't know. But for the future, for people who have a lot longer to live than I do, to change that habit. And for example, I just broke my femur. I was on pain medication, and I only took it once a day when I went to bed at night, and it was a narcotic. And I finally realized, this has been 2 months, and I was supposed to take one every 4 to 6 hours as needed for pain, and I didn't. I only took it at bedtime. Super Bowl Sunday, I said, I hurt, but do I hurt that bad? And I was taking the medication because I was afraid I'd hurt worse. I quit taking it. And and because I was only taking one a day, I wasn't addicted to it or anything. I just didn't want to depend on it. I have to fly to Nashville next month. The month after that, I have to fly to Wisconsin to another board meeting, and I have to be alert when I go to these meetings, and I have to be alert when I go to the pharmacy every day. I give immunization shots every day. I do consulting. I help with compounding. You don't see me working at the counter unless I step out of the office and see one of you and tell you hi. But it took some effort, and I had to tell myself I'm doing what I would ask you to do, and I wondered if I could do it or not. And of course, it also has to do with the pain threshold that you have. I have a fairly substantial high pain threshold that I can live with a lot of pain. A lot of people can't do that. But what we're finding when we're tapering people off these medications is that they aren't in any more pain. Their pain is from withdrawal if they try to taper off. I haven't taken that, so I don't go that routine. I'm going to talk a little bit about heart attacks before you have one. And again, our number is 263-5252, but you need to know about what will happen if you're having a heart attack and how you're going to know. The number one rule is no matter whether you're a doctor or a pharmacist or a nurse, don't diagnose yourself. Call 911. If you have the slightest suspicion that you may be having a heart attack, because most heart attacks, death happens in the first hour after an attack. Waiting several hours before calling for help could be deadly. So if you have any symptoms, call 911. You probably know what those symptoms are. Most heart attacks have a discomfort in the center of your chest that lasts for more than a few minutes. Sometimes it goes away and then it comes back, but it may feel just like an uncomfortable level of pressure, a squeezing, and full of pain. So upper body discomfort where you have pain in one or both arms, your back, neck, jaw, or stomach could signal a problem, shortness of breath. Other signals, and these are normally for females, cold sweats, nausea, lightheadedness, overwhelming fatigue, or a feeling of impending doom. Some people get that pressure, just pressure, no pain, just pressure on your chest. Maybe and maybe not, it's a heart attack. The blood supply to the heart muscle is interrupted and the heart muscle swells. The cells could start to die, which would cause the chest pain, but sometimes it doesn't, especially in women. Most heart attacks build up slowly with mild pain or discomfort. Sometimes you'll go into the hospital and they will tell you you had a heart attack. So, yeah, you can have a heart attack and not know it, and it can happen to any of us. If you have diabetes, you're more likely to have what they call a silent heart attack. You may not experience any of the heart attack symptoms like the chest pain, but you may feel a little nauseous, short of breath, or even faint. And, you know, we have those things happen to us sometimes all the time. We're busy. We don't think anything about it. Somebody will say, don't you feel well? And I said, you know, I just don't. I can remember, I don't know how many friends I've had that go to bed at night and say, you know, I just don't feel right. I'm nauseated, and I go to bed and they don't wake up in the morning. That's an ideal way to go, by the way, if that's the way you have to go. But that probably could have been saved if that individual had gone to the hospital. And, Paul, do you know what time of day is most significant about having a heart attack? And if so, why?
We've talked about this before.
Yes, we have. That's why I'm testing you.
Oh, boy. I'm going to say morning. I don't know why that sounds right, but I don't know if it is.
It is. It occurs more frequently in the early hours of the morning, about 40% more common between 6 a.m. and noon than at any other time of the day. Cardiac deaths are 29% more common in the morning. Here's the reason. We get up in the morning and our circulatory system is not efficient. We've been at rest. Our heart has been pumping slower. We've been in REM sleep. You get up in the morning, you don't feel like you're quite there. I used to get up in the morning and get on the treadmill at 4:30 and go for 3 miles. And I quit doing that without warming up and working out a little bit ahead of time because I never ran on the treadmill, or I haven't since I've had bad knees, but I walk at a rapid pace. So all of a sudden, your circulatory system and your central nervous system, which is your brain, has to activate and become more efficient. Those blood vessels are kind of collapsed during the nighttime, meaning they're not flat, but they're not pushing very much blood through because you're not at full efficiency. So you get up in the morning and first thing you do is test it by having an early workout. And you don't have to be working out. You could be walking to the bathroom. But that's why it occurs. And sometimes patients will ask me, do I take my blood pressure medication excuse me, at night or in the morning? And I will tell them, what did your physician tell you? And they said just once a day. I said, well, most people, because they're having a hard time during the day because you have a lot of stress during the day, we'll take them in the morning. For example, I get up at 5 o'clock and I take all the medicines that I take for the day except for an anti-inflammatory that I take at bedtime as well. And because I'm not compliant otherwise, if I had to take it 3 times a day or 4 times a day, but their question is whether I should take it at bedtime. When people add, or physicians add another medication to them, frequently I will suggest to them, if the doctor hasn't told you and you're having problems, because when you get up in the morning at first, that's when your blood pressure is the highest because it's not very efficient. So if you're having a hard time getting that blood pressure down in the morning when you're at high risk, then I would take that second medication at bedtime. If it's a time-release medication, it will last even if it's a beta blocker like altenolol or propanolol or something, I would take it, and it will keep you going for about 12 hours. So it's up to your physician what they want to tell you to do. I'm just telling you, if you're having trouble in the morning and you're taking 2 medications for your heart, the only contraindication to that would be if you're taking a diuretic, which is something that makes you urinate more frequently. If you're taking that, don't take it at nighttime because you'll be up going to the bathroom all night long. So what should you do if you think you're having a heart attack? Well, you call for an ambulance immediately. Stay calm, sit or lie still, chew 1 5-grain aspirin, and it's a 325 milligram or 300. I know you've probably been taking baby aspirin, which is 81 milligram. If you have to take 4 of those, take 4 of those. It helps minimize the heart damage and development of a blood clot by reducing the amount of platelets that stick to your blood vessels. And it helps in blood clotting. So also make sure your doctor is unlocked, so emergency response, or your house is unlocked. So you don't think about that, but this is nighttime usually, or the first thing in the morning. And if the paramedics come and they can't get into your house and you're there by yourself, it just takes more time. So you don't eat or drink anything. Phone somebody that can come wait with you. And in case you go into respiratory failure, cardiac failure, they can do CPR for you. So the first thing you do is take that 5-grain aspirin, 300 to 325 milligrams, get it into your system, get it dissolved, and it'll do its work. What do you do when you get to the hospital? Well, they'll hook you up to a cardiac monitor and an IV drip, and you'll be given oxygen and maybe pain medication while they do an EKG or an ECG. And they measure the electrical impulses to detect if you have AFib or any irregular rhythm. And they'll take a blood sample to see if they measure the levels of an enzyme called troponin, which is released into the bloodstream if the heart is damaged or dying. So depending on the amount of troponin that you have in your system, will really have to do with where they go from there. If you reach there quickly and they open up your coronary arteries mechanically, sometimes after they see a blockage, and they'll put in a coronary angioplasty, which is a little tube that they run up through your femur or your wrist, and a small amount of dye is injected so they can see where the blockage is, and then they inflate the balloon to widen the artery, and then they put the small metal coil in there, which is a stent, and they leave it in place to keep the artery open until further blockages. So used to be it was open heart surgery. They had to cut you open. Now they don't have to do that in many cases. Of course, exercising after a heart attack is going to be prescribed by your doctor. They may recommend cardio-like walking or jogging like they have at Sutter. They have a area out there where you can do walks for after you had a heart attack or a stroke. So just remember that. Think about these things that I've said, and just remember when something like that happens that you need to act immediately. A few minutes left. Generics, we're going to have more generics coming on the market. You'll see top-selling drugs go generic this month or this year. Crestor, which is a big deal. It's the only high-intensity statin besides atorvastatin, and it's very expensive. We figure that will become generic in May. Gleevec, which is for leukemia, and this should be a game changer for certain because it's $10,000 a month to get a generic out there, and it's coming out this month, I think. Benicar should be in October, where a handful of other generics are going to come on the market, and Zetia, which maybe next year, is another one that is going to be on the market. So be aware that there's some light at the end of the tunnel. I just had, this was my 4 o'clock in the morning conference call from the East Coast, and went over a bunch of those things that are going to be happening by March. And keep you aware. We'll let you know when those things become generic, and whether or not that we should get the insurance company to give you a better price, and that's part of what's going on. They try to keep it as high as they can. Cough and cold, when Sudafed became behind the counter, they went to PE, which is phenylephrine. So if you see Sudafed PE, that doesn't really work as well as the pseudoephedrine. New evidence suggests that it isn't better than a placebo because it's poorly absorbed. They still have it on the market. People still say it works, but the difficulty is to get real pseudoephedrine or an antihistamine with pseudoephedrine. You have to go up to the counter, get your license, driver's license, ID, date of birth, and then we can sell it to you. But it has to be recorded for DEA purposes because it's used in making methamphetamines. The flu season is just coming around. We have a few shots left. They're already coming out with the new formula for next year. They'll have the information out as soon as possible. But there will probably be a different tier of flu shots recommended, and we're trying to get Medicare to make sure that they let them, that they will pay for them like they have in the past. We certainly hope that will happen, and more people will get a flu shot that haven't gotten them before because they will be paid for. We still don't have Zostavax okayed. They're going to go to a new program. The Merck detail person was in yesterday. They're finding there's more success at age 50 than there is to start it at age 60. So they're going to start promoting through physicians that they have an earlier date of 50 years old to begin the therapy. So hopefully we will get Medicare to pay for. They don't pay for any of it right now. So we are hoping that will be something that they will take up in the future. I want to remind you that we deliver to Kelseyville, and the Kelseyville area, the Rivieras, and Buckingham. So if you have any prescriptions, you need to go out there, give us a call, and we'll get them to you. I'd like to remind you we're North Lake Medical Pharmacy with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192, and outside the Bruno, Shop Smart at 263-1328. So, Paul, happy Super Bowl past.
Yes.
And we're looking forward to spring.
Absolutely, and we'll see everybody back here again next Wednesday at 10 a.m. for Health Talk on AM 1270 and 96.5 FM, KXBX Lakeport.